super fun place to get cut off in the middle of yeast infections. But as I was saying, the fungal growth is able to grow better with the amount of glycogen that gets added to the the increased amount of glycogen is what I'm trying to say. Sorry, lost my train of thought for a minute. So next we have changes in breasts. This is preparation for nursing. It's increased size and has a full feeling. They may start to secrete early fluids, and this is known as colostrum. Okay, so before we, so the next thing we're going to talk about are later changes in the female body, and the first one is blood pressure. So for the most part, blood pressure should remain normal. However, there are a few things that can cause changes to the blood pressure, such as change due to the weight in the uterus. So supine hypertension is when there's pressure on major vessels to the uterus, and if the mother's blood pressure drops, so does the baby's. And then just normal hypertension could be signs of complications if there's anything going on. So next later change we're going to talk about is the change in urination. So urinary frequency increases due to pressure on the bladder. So early on, early in the pregnancy, it's because the uterus is low on the bladder. Later on, it's because the baby's head actually rests on the bladder. There's also could be small amounts of sugar in urine of the mother. Minimal amount is fairly normal. A high amount could be a sign of gestational diabetes. The mother's posture changes. So due to the softening of the pelvic joints and ligaments, her center of gravity changes. So again, the pelvis softens and widens, which changes her stance, which gives her more stable gait to keep her from falling, because her center of gravity changes so drastically with the baby growing outward in her abdominal area. Lordosis is the forward curve of the lumbar spine that occurs with the female development of pregnancy. The mother's weight will change. This can be very controversial